Hi, everybody. I'm Angela Hart. Welcome to the Heart of New York show. I have the privilege of having a very distinguished guest on the television show today. He's an expert in the field of Medicare and Medicaid because he works for Medicare. I'm going to allow him to introduce himself to you, and he's got a lot of information for those of us who are getting to that point or at that point of needing Medicare. Welcome, Frank.
Thank you, Angela. My name is Frank Winter. I'm with the Centers for Medicare and Medicaid Services, New York Regional Office, and I work as a partnership manager in the Office of External Affairs. And what we do at that office is to talk a little bit with the public about how Medicare works. And we also have a lot of responsibility in terms of managing the Medicare program, as well as working with the states to manage the Medicaid program, to oversee we call it the survey and certification of hospitals and nursing homes. So we try to make sure that they're providing quality service to the public. But my role specifically is really outreach and education. So explaining how our programs work.
Thank you. And tell us, how do they work?
Well, there are a lot of difficult choices that people have to make relating to their health insurance. People, I would say, from all the polling and things like that, are very satisfied with Medicare. It's one of the most popular government programs. But still, when people are new to Medicare, they have a lot of choices to make in terms of what coverage they want to sign up for. And, in many cases, they may have some coverage from the job they used to work at. They may have retiree coverage, and they want to figure out, how do I coordinate that coverage with Medicare? So we try to give people information about that. One of the best tools that people get is we send them a handbook every year, Medicare and You handbook in the mail. We also have a great website, medicare.gov, that people can go to learn more about the programs. But a lot of folks, they want to talk to a live person. They don't want to call an 800 number. And so we also have a great program called the State Health Insurance Assistance Program. New York, it has a little bit of a different name. It's called HICAP. But basically, they're folks who will meet with you. They're volunteers who are seniors, who are retirees by and large, who will meet with you and talk to you about your Medicare options, make sure you're getting what you should be getting in terms of benefits, that you have good advice in terms of selecting your coverage. And so best way to contact them in New York City is to call 311. You can also look on the back cover of that handbook we send every year, Medicare and You, or go to the Medicare.gov website, and those folks can help you make decisions about your Medicare.
Wow. Now, I suppose that most people getting on Medicare these days are internet comfortable, correct? Whereas maybe 20 years ago.
A lot more, yes, are using the website. It's gotten more popular over time, absolutely.
What kind of challenges does your agency have in terms of reaching the community and educating them about what they need to know?
Well, I think some of the challenges are that it's really, in many cases, health is a family issue. So folks think, if I'm not having a problem right now, that I don't need to know about this. But it's important to think about, you may have parents, you may have grandparents who may need help figuring out their coverage, and they may not speak up to you. And in some cases, as you mentioned, a lot of the folks who are now aging into Medicare, they're more comfortable doing this research on the website themselves. We encourage people to use it. I think it's a really good website. But in many cases, folks do need a helping hand, and a lot of times, if you're the son, you're the daughter-in-law, the son-in-law, you can actually guide your parents or your grandparents in the right direction. You may be able to help them use the website, and you just let them know about the resources. A lot of people don't know that there's that in-person help available that I mentioned, the State Health Insurance Assistance Program. They don't know they can find out about that, don't know where the website is. They just assume it's not there. And so we all have a role. We all have a responsibility with our friends and family to kind of help them know, share some information on Facebook sometimes. If you use that website or websites, social media websites like that, so that your family members kind of know, because we all need a little help with this stuff.
What were you saying before about that there are volunteers how do we find these volunteers, and do they charge money, and what's involved?
Free service. Our busiest time of year is during open enrollment.
And when is that?
October 15th through December 7th of each year. And that's the time where a lot of folks make an appointment with those counselors and kind of get guided through the process. And in New York City, you can just call 311, say you need help with your Medicare, and you can meet with a counselor. They provide the help over the phone or in person if you want to come into their office. And if you're elsewhere in the country, the help's also available. You can go to the Medicare website or look on the back cover of your Medicare New Handbook. That's the phone number for the counseling program in your area, or you can call One Hair Medicare, and they will also refer you to a counselor if you'd like. So a lot of people don't know about that program. It's something we always trying to get the word out about.
Well, that's what I want to do right now. So, who are these counselors? Are they insurance professionals? Are they financial planners? Who are they? You said they're volunteers,
They're
but what is their
volunteers.
background?
A lot of them are retirees. A lot of them worked in health care or in the government or insurance in their previous lives, and then they decided if anyone's interested out there, you can volunteer. It's very satisfying because a lot of times you're taking a topic that can be complicated and challenging for folks, selecting your health insurance, and you can really help them. And so, one, it's great help for folks who want to access it, but we've had many people who've been helped by that program who've actually gone on to be volunteers by themselves because they started to get interested in all the issues and learning more. And so it can be a very satisfying volunteer opportunity for a lot of folks. I do want to talk about something, though, that's new that's going on with the Medicare program, if we can.
Sure, tell us.
So one of the big things that's coming down the pipeline is new Medicare cards. We have almost 60 million people with Medicare across the country. That's a lot of folks. And they all have had a Medicare card, and many people have had the same card in their wallet or at home for Medicare for 15, 20, 25 years. They haven't had to do anything with it. Well, what we've been told from folks is, why is we don't want the Social Security number on our Medicare card. Mm-hmm. We always tell people, protect your card, guard your card, but people will say, well, you tell me to guard my card, but I have to take it to the doctor's office when I see the doctor, and it has my Social Security number on it. So if someone steals that, that's so valuable to them. So Congress listened. A couple years ago, they passed a law to remove the Social Security number from the Medicare card and to replace it with a new number.
Excellent. This is long in coming. That's good.
Yes, it's great, but it's more complicated than you might think in the sense that the government has a lot of computer systems, Social Security, our agency, the Centers for Medicare and Medicaid Services, also your doctor's office, the hospital, they all need to use your number in order to bill for services to Medicare. So it's taken a little while to implement, but starting in April, people will start to receive their new Medicare card. Okay.
A lot of us want to know, the viewers want to know, what is the difference between Medicaid and Medicare? And I've heard about dual coverage. Can you speak to that?
Sure. Well, the difference between Medicare and Medicaid is sort of how you are eligible, and then there's some differences in terms of the coverage. So with Medicare, you become eligible just based on the fact that you're 65 and you're either a citizen or you have 5 years of legal residency. Or alternately, there are some younger folks who are on Medicare who have, if you are eligible for Social Security disability benefits for 2 years, and in some cases for a shorter period of time, but mostly those who are eligible for 2 years, or those who have end-stage kidney disease, so serious kidney disease. That's the other category of folks who are eligible for Medicare. Relates not at all to your income, whether you're eligible for Medicare.
Oh.
Not at all. With Medicaid, it relates to your income. And in some cases also to your needs, to the fact that you have medical needs, or fall into other certain eligibility categories. But one factor in Medicaid eligibility is always going to be your income, and in some cases your assets are considered. For those who are 65 and older, whether you're eligible for Medicaid depends partially on what assets you have. If you're between 18 and 65, we don't look at your assets anymore. It's just your income. So that was a change that happened just a few years ago. And the coverage for Medicaid is different in each state because Medicaid is a program that's funded in part by the federal government and in part by your state. So the state makes a lot of decisions about what Medicaid covers. But with the Medicare program, it's really a national benefit. So Medicare is pretty much the same across the country.
Okay.
I do want to get back, though, to talking a little bit about the Medicare cards, because this is really important. You may think, well, okay, so you're sending me a new card. No, it's great the Social Security number is not on there, but, otherwise no big deal, right? Get it in the mail, replace it. Well, there are a lot of people who their job is, unfortunately, to try and defraud health insurance companies and also Medicare beneficiaries. And so even though we think that removing the Social Security number is going to be a great thing in the long run, there's still the fact that we have approximately 60 million Medicare cards that are going to be sent out across the country. And unfortunately, as people may know who've ever been sent something important in the mail, there are people who try to steal things that are sent in the mail.
Well, I hope you're going to stagger it then.
We are staggering it, and in fact, it starts in April, but we sending them out gradually across the country. In New York and New Jersey, it's going to be over the summer. So that's something people look out for that in the summer. Also, the other really important thing to know is that those who have Medicare particularly are targeted by telemarketers who are trying to commit fraud.
What do you mean by that?
People will call folks up out of the blue and will say, well, I'm with the government and I'm calling you because I need some information from you in order to send you your Medicare card.
Oh, viewers.
I need your bank account number. I need your Social Security number.
This is very important for those of us who have friends and elderly relatives who are going to be anticipating receiving a new card. Do not fall for this scam. I can't believe what you're saying. So
Yes.
do not ever, ever give out your bank account or your Social Security or date of birth to anyone who calls you, because Medicare will not ask for this information on the telephone unless you're calling their office and you have their
Exactly.
number.
If you need information, if you're wondering why didn't I get my card yet, don't fall for someone who calls you out of the blue. Call 1-800-MEDICARE yourself, or call your local Social Security office, or the national 1-800-772-1213, the national Social Security number. Don't talk to somebody who calls you out of the blue asking you for your information. It's very important. People fall for this all the time. And most often when we get calls for people reporting fraud on 1-800-MEDICARE, people just talk to someone over the phone and they say, there was someone who called me. I probably shouldn't have given my information, but I did.
Uh-oh.
That's too late. Just never do it. If somebody calls you out of the blue, never give your Social Security. Never give them the bank account number. Medicare, Social Security, we won't call you. We'll return your call,
That's
but we
different.
won't call you out of the blue ever asking for your personal information. So you have to protect that. And now people need to be aware too. It's wonderful. A lot of seniors are more web savvy and other Medicare beneficiaries, and they use our websites. They use Medicare.gov and mymedicare.gov to keep track of their Medicare statements. They use the Social Security website. But there's a thing called phishing. People send emails out to folks saying the same thing. I'm with Medicare. I need your information. I'm with Social Security. Click on this link to get more information about the new Medicare card. Provide your information. Don't do it. Don't fall for that. We won't be sending information with links that you have to click on where you provide us information out of the blue. If you get an email that's suspicious, don't open it or call 1-800-MEDICARE or Social Security. Another thing, I mentioned the fact that we're sending all these cards out and people try to steal the cards. You do want to make sure that your address is updated with Social Security so that you receive your new Medicare card.
And how can people update this information?
So people can call Social Security, 1-800-772-1213, or they can go to the Social Security website. And if they have an account there, or if they don't, they can open an account. But otherwise, they can use their account to update their address. And that's really important now because a lot of folks, because they interact with Social Security and Medicare, and this is true in other areas too of our lives. We may have an account with the bank and we do online banking, but then what happens when the bank needs to send us something. Well, we better have our address updated. So just because you do things online, it doesn't mean when you move, if your address changes, that you don't need to update it. So you have to be careful if you've moved recently, if you haven't received any mail recently from Medicare or Social Security, go ahead, reach out to Social Security, either call them up or go to the website, make sure that they have the correct address for you. Just because you're getting your check through direct deposit every month doesn't mean they have the right address. And if they don't, then it could go to the wrong place. It goes to the wrong place, someone could misuse your card, and you may not have it when you need it too.
So would you please say the proper web address for both entities, Social and Medicare?
Okay, so the Medicare website, it's medicare.gov. For Social Security, it's ssa.gov. You can also get to their website by typing in socialsecurity.gov, but they change it to ssa.gov. So they have both of those websites in their possession. But that's where you want to go. And again, if you get an email that says it's from Social Security or Medicare,
Ignore it.
Just go to the website yourself, type it in, enter it yourself, because you don't want to be clicking on links in emails, because unfortunately that's a big source of fraud and abuse. And we've had this, believe me, whenever we've had a new program, unfortunately, we've already heard reports of fraud relating to the new Medicare card of the type that I talked about. But this happens whenever we have a new program, because what happens is that all that publicity, people hear something about, I'm supposed to get a new Medicare card from their neighbor, and then they start to wonder, did I get it? Why didn't I get it? And then they are susceptible to people who, I'll solve your problem. I'm calling you out of the blue. I have the answer for you about how you get the new card. Don't fall for it. Please
Excellent.
don't fall for it.
And so when we get these phone calls, especially even if we're aware that it must be a scam, who should we report it to, Medicare or to the FBI? What do you do with these calls if you find out about it, you, the agency?
Sure. You can call 1-800-MEDICARE and give us as much information as you possibly can. Our recommendation is if somebody calls you and they're asking for that information, just hang up on them.
Yeah.
Don't worry about, playing detective. However, if you do talk to someone, if you make that mistake of giving out your information, hopefully you don't, any information that you have about what the person told you, that's going to be helpful for us, and you can call 1-800-MEDICARE. The same thing with emails. An email you have, you can call 1-800-MEDICARE, let them know that you received an email. Don't click on any links. If they ask you to forward it to them, that's great. That might be helpful for us in terms of being aware what's out there. There also is a great program, another volunteer program called the SMP, or Senior Medicare Patrol. And that's another program you can reach out to about these kind of issues. It's a volunteer program of seniors and by and large, who basically try and educate other Medicare beneficiaries about fraud and abuse, and also even investigate fraud and abuse. So a lot of folks who maybe were in a law enforcement or healthcare background decide, hey, or just they're interested in these issues, they volunteer to be part of that Senior Medicare Patrol. So
Thank
that's
you.
another
Excellent.
opportunity. People go to the Medicare website, they can find out more about that. But that's another place where people can certainly report these sorts of things. But
Thank
1-800-MEDICARE is the easiest.
Thank you. So what other programs do you offer?
So I mentioned, of course, Medicare is our flagship program. Medicaid is a program that we help fund the states to provide, and each state program is a little bit different. We also helped set up the health insurance marketplaces across the country. So for people who don't have health insurance through their work, need to purchase coverage, they can get coverage through the health insurance marketplace.
But do you have to be 65 and older, and is that when we're eligible for Medicare?
Well, you don't have to be 65, really. In fact, if you are eligible for Medicare, the health insurance marketplace is not right for you. So once people turn 65, if they're eligible for Medicare, if they are a citizen or have been a legal resident for 5 years, or if they're eligible for Medicare for the other reasons we talked about, maybe they have kidney disease or they have a disability and have been collecting Social Security disability for a couple years, then they're eligible for Medicare, and that's really where they want to get their coverage. Although if someone is 65 and older and they're still working, they may, they have some different decisions that they need to make. And that's where those counselors I talked about, those SHIP counselors, can really be helpful. Yep. Now, we do have some other things that our agency does. We help ensure the quality of care provided at hospitals and nursing homes, and we work to do that with state government. So there are federal rules for that regulate what hospitals are supposed to be doing to ensure quality, what nursing homes and other skilled nursing facilities are doing, so that people are getting good care. And folks, if they have issues with that and they have complaints about the care, there's a process where people can make complaints. And a good place to start also on that process is to go to our website, Medicare.gov, or call 1-800-MEDICARE, and they can direct you to where to make a quality of care complaint. If you have a family member in a nursing home and they're not being treated well, you can make a complaint about that.
That's good to know. That's excellent information. So we have about 6 minutes left, and I was wondering if there's some other things you wanted to share with the viewers.
Sure. Well, one thing that we always try and educate the public about is and get information out is about making informed choices about your health coverage. And I mentioned the fact that we do have volunteer counselors in the Medicare program, the SHIP counselors, who can help you to do that. There also are other things that folks can do, other assistance that's available. For folks who are not eligible for Medicare, we have navigators across the country who can help people make decisions about their health care and help them to select what coverage might be best for them. So if folks go to healthcare.gov, our website healthcare.gov, or in New York, if they go to the New York State of Health website, they can get linked up with navigators who can help them also make decisions about their health coverage, help make them aware of what they might be eligible for. We encourage everyone. I mentioned annual enrollment for Medicare. It's not just Medicare that has annual enrollment. Many people through their job have a choice in terms of their health insurance and have an enrollment period each year where they can make changes. And folks who have coverage through the marketplace that I mentioned, which in New York is called the New York State of Health, they have an annual enrollment period each year where they can make changes. You'll get information both from the insurance company and other sources of your coverage about the changes that they'll be making to your coverage each year. And it's very important as annual enrollment rolls around to read that information. If you need to talk to somebody, it could be a navigator if you don't have Medicare, or it could be your human resources folks at work. And if you have Medicare, it could be a SHIP counselor calling 1-800-MEDICARE. But
Excuse me, what counselor?
A SHIP counselor. Those counselors I mentioned, State Health Insurance Assistance Program.
The acronyms, right?
Yes.
So, Frank, you mentioned that open enrollment is in October of every year. So what
That's
if
for
someone,
Medicare, absolutely.
Right, but what if someone turns 65 in January of that year? What happens?
Well, then you have what's called an initial enrollment period. So that's your first opportunity to sign up for Medicare. So that includes for someone who's aging into Medicare. We'll talk about those folks first. It's 3 months before the month of your 65th birthday, the month of your 65th birthday, and the 3 months after. But we really encourage folks, sign up before your birthday so you don't have a gap in coverage.
Okay.
Now, if you're still working and you have coverage through your job, or if your spouse is still working and you have coverage through your spouse's job, you can delay your Medicare Part B, which covers physician and outpatient services, without penalty. Most people in that situation, they sign up for Part A because in most cases you don't have to pay for Part A. That'll work well for you. But they may delay because they don't want to pay the premium for Medicare and also the premium for their work coverage. In some cases, that is allowed. And usually that's if you have a larger employer. But you'll always want to talk to your human resources folks at your job and see, do I have to sign up for Medicare Part B or not? They can help guide you in that process. And if you don't have to sign up right away, it can save you some money by not paying the premium. But then the catch is when you lose that coverage, when you retire and you no longer have that employer coverage, or you no longer have it through your spouse's work, then you do have to sign up for Medicare. You have 7 months But we encourage you, again, not to wait. People actually forget to do it. They get penalized for signing up late for their Medicare.
How much do they get penalized?
10% a year for being late for
10%
signing
of
up.
what?
The Medicare premium. So you're paying an extra 10% for each year you're late. And you can only sign up during a limited time of year called the general enrollment period. It's a different enrollment period. Runs from January through March of the year. Your coverage won't start until July. So you have a huge gap in coverage. So it's very important not to make that mistake. And one common a couple common pitfalls that people fall into that I just want to warn folks about.
Please.
Because again, it makes sense. Save the money. If don't have to sign up for Medicare Part B and you have employer coverage, it's great. Save the money. You can put it off. But just don't make these mistakes. So COBRA, when people extend their coverage through COBRA, that's not considered employer coverage anymore. So if you have COBRA, you don't have employer coverage, you're going to be penalized if you don't sign up for Medicare.
Wow, that's a biggie.
Yeah, absolutely.
I wouldn't have known that.
Some people have their hours cut at work, so they're no longer eligible for the employer coverage, and they're switched over to the retiree plan.
So
You're still working, but the coverage is not that full employer coverage. It's a retiree plan. Retiree plans don't count. So again, you'll be penalized for signing up late. So it's important to talk to your human resources department, and if it's covered through a union, talk to them to make sure when you have to sign up for Medicare. You can also talk to Social Security in your local Social Security office.
thank you, Frank. This has been very informative. We're about to close, and was there a final point you wanted to make before we say goodbye to the viewers?
Just want to encourage folks to check out our online resources, again, Medicare.gov, SSA.gov, or SocialSecurity.gov for more information about Medicare and Social Security programs.
Thank you for coming on the show. Very helpful.
Thanks for having me on.
And viewers, we're on every Tuesday night at 8 p.m. on Channel 34 in Staten Island, but we're also on at 8:30 in Brooklyn and all the other boroughs. And you can find us on YouTube, The Heart of New York Show. So thanks for watching. Goodbye.